Why is my patient's ventilator alarming? My name is Kaylee, I'm an ICU nurse, and I'm going to take you through the DOPE mnemonic today, and this is something you can use to help troubleshoot ventilator alarms and inadequate ventilation. So just real quick, what is inadequate ventilation? So ventilation is the breath in and out of the lungs. If a patient is not ventilating adequately, you may be alerted by alarms on the ventilator, or you may see that the patient is hypoxic. So how do we treat this? This is when we go to the DOPE mnemonic. D is displaced. You want to look to see if the tube is displaced. Each ET tube has an exit site number that is marked on the tube. You want to see if this number has changed at all. If the tube has been pushed farther in, it may only be ventilating the right side of the lung. And if the tube has been pulled out, it may not be ventilating the lungs. So first, look to see if the tube is displaced. If the tube is not displaced, next, look to see if the tube is obstructed. Obstruction in the ET tube can occur due to the patient biting on the tube. There may be mucus built up, or there may be a kink in the tubing. If the tube is not displaced or obstructed, you want to see if there is a pneumothorax. We can assess for a pneumothorax by inspecting the patient's chest and looking for bilateral symmetrical chest rise. Next, you want to auscultate the lungs and see if there's absent breath sounds. If you notice absent breath sounds and asymmetry that would be concerning for a pneumothorax, and you would anticipate a chest x-ray. So if the tube is not displaced, obstructed, there's no concern for a pneumothorax, you then want to look at the equipment. You want to look and make sure all the connections are tight. Look to see that the oxygen is hooked up appropriately to the ventilator. And also look at ventilator settings. So overall, use the DOPE mnemonic to look to see if the ET tube is displaced, obstructed, if there's a pneumothorax, or if there's any malfunctions in equipment. Always remember to practice within your scope if you're an RN, an RT, or an MD.